Hello, everyone. My name is Jasmine Kaur, and I'm the executive producer at the National Library of Patient Rights and Advocacy. And today it is an absolute privilege for me to introduce a very special guest, the founder of the National Library of Patient Rights and Advocacy, Mr. Bob Kieserman. Welcome to the show, Mr. Kieserman.
Thank you. Thank you.
Thank you so much for joining us today. And we know that the library has played such a remarkable role in educating, empowering, and advocating individuals across the globe with trusted health related information. And what excites me the most is to know the story behind how this initiative came to be. So, can you share the inspiration behind starting the library and what vision guided its development?
Okay, sure. In 2014, I was 3 years away from retiring after a 35-year career as a professor of healthcare administration and medical ethics. I had a group of students, mostly seniors, who shared a tremendous interest with me in patient rights. And we had studied it in the classroom, and they also studied it outside the classroom with me. And I had this idea that we should hopefully put a website together that would include a wide variety of media that would talk about things like patient rights and treatment plans and diseases, and very much inspired by WebMD, but we were going to do it in a different way. These students were very passionate about working with me. And what happened was that with their input, I was able to reach out to some professionals at that point. Been very fortunate throughout my career, especially with the library, to work with some very special people, not just students, but professionals in the field. And there was a young woman named Shannon DeVita, who's an actress and a comedian and a videographer. And she agreed to work with me. And we then did a search and found a host for our videos. And little by little, we added to our video library. It was a very busy time between 2014 and 2017. We literally were out in the field almost every single day. I had many videographers working with me. I had many hosts working with me. And I served as the executive producer, so I would identify the interviews, then send people out. Because we are headquartered, or were headquartered at that time, this is pre-COVID, Philadelphia, we had the ability to go all over the Philadelphia area and record these. And Philadelphia, for those who do not know, is one of the meccas in the world for healthcare. We have some of the greatest doctors in the world practicing here in Philadelphia. So we had plenty of places to go and plenty of things to review. And so that was the beginning of what we called Health and Wellness, which was our first name. We developed a web series called Health and Wellness, well received. And then we moved toward expanding it with some resources where people could click a resource and it would take them to the webpage of the American Heart Association or the American Cancer Association or countless others. And then in 2017, right before I retired, the National Library of Medicine in Bethesda, Maryland, recognized us as the National Library of Patient Rights and Advocacy. And we've worked under that name since then. So that's a basic overview of how it began.
Yeah. And thank you for sharing that. It started in 2014. It's almost 11 years in making, and it's still growing as an organization. And what sounds most prominent is the power of collaboration with the physicians and many more enthusiasts about health and wellness, just like yourself. So how has the experience been working with those people, the young generation or the younger generation, I might say, or just working and mentoring with those students, and what do you think is the impact that that has had on the organization as a whole?
Very good question. When I started this, because it was started with my students and I've been a lifelong professor as a career, I promised myself that when we expanded this to other people, I would limit it. Maybe that's not the right word, but limit it to young professionals. Because for many years, I, as a professor, also oversaw the internship program at the School of Business where I was. And I realized that once people got out of college or they were making transitions from one job to another, they needed a place to practice their craft. So this has worked out beautifully for me and for them. And been a learning opportunity for me and certainly for them. And probably one of the most gratifying things that I have had in this whole situation is that most of the people who have worked with us, not a few, but most, have used this as a platform for going on to a better job, a new career in the area of television production. Many of them have ended up places like NBC, NFL Films. I had one woman who worked with me for about 2 years, and she ended up being the videographer for the United States Navy. In terms of writing, people have gone on to work with primary publishers. Some have actually gone back to school and learned public health and use this as an inspiration to study public health. So I stay in touch with most of the people. I give them an open invitation that if they need my help, I'm available. And so we've had probably 600 people work with us over the past 11 years. And I hear from many of them, and many of them, as I said, have become very successful, and I feel very good about that. So in answer to your question, we have made it our business to extend invitations to work with us to young professionals. And it's been a tremendous investment for us. I just can't tell you how much I've gained and how much the project has gained from their talents. Unbelievably talented people in all aspects of operation, just very talented people.
Yes, absolutely. And been working with this organization, from the past year. It is a platform for growth. And as much as you praise the mentees, I think it's the mentor that I would place at the center of things.
Thank you.
So what do you think sets your leadership aside from everything else? And what is it that you do that sets you apart?
I would have to say that it's simply that because I mentored people my whole career, I feel that I can relate young professionals. I have been there. Um, Real fast story that I've told many times. When I was sitting in a classroom in graduate school, getting my MBA, somebody came in at the break and announced that there was a need up at the medical school, at Temple University Medical School, for someone to work in the financial management office. And so, having had some work experience, I got on the phone. We didn't have cell phones then. This was in the 80s. I went on a payphone. People know what a payphone is. We dropped coins in, then make a phone call. Um, and I got on the phone. I called the director and said, I'm down at Temple University's main campus. I heard about your need. Can I come up after my class? They said, sure. Long story short, I ended up getting a graduate assistantship there. And then once I finished my MBA, or came close to finishing my MBA, they hired me. I became director of operations analysis. I also had the opportunity to work with the continuing education department of the medical school and got to know many of the doctors. That was when I made a transition from my first career, which was in retailing, to healthcare. And I got to lecture, I got to mentor. So that job, that opportunity changed my life completely. And so I was in the right place at the right time and took advantage of it. And that's basically what I want my mentees to do, to be in the right place at the right time and grow. So I appreciate your compliment. And that's really the story of why I feel that I've been successful with this, because I can relate to where they've been, and I want them to be able to have the same opportunity that I once enjoyed.
Yeah, absolutely. And I think it's one of the cornerstones of a great leadership is forming a connection with the people that you lead. So absolutely, I have experienced this myself as well. Um, from our conversation, what stands out the most is that you value learning so much, and you value people with who share some passion, and you want them to grow within the organization. And that was how this organization started. um, that just makes me curious about the challenges that you might have faced over the years, because you're starting something new, you're starting something, a place for passionate people. So I'm sure it didn't come without challenges. So in expanding and building such an organization, how did those challenges come into play with your leadership, and how did you navigate through them?
Well, as I indicated earlier, I once had your job in the organization, which was to oversee the video production. And early in, when we were filming these things almost literally every day, there were people who I just spoke about the dependability and how, well, I had some non-dependable people. And we would set up an interview, and either the host would not show up or the videographer wouldn't show up. And these were important people with tight schedules. So there was nothing I could do about it. And it was very frustrating. And all I could do was apologize to the guest. Many times we were working through the public relations departments of the hospitals, set up the interviews. And, I needed to have a good relationship with them so that every time I wanted to interview a doctor in their system, they were open to it. So if we had a no-show, they weren't too happy. That was one frustration. The second frustration is there were times when we didn't have enough people, and we constantly advertised on the Indeed and LinkedIn, um, and so we had to cut back on our initiatives. That's all. But fortunately, um, I got smart after a long time and started to delegate responsibility to other people. And that has helped tremendously, because it's important to, that's a lesson that I learned personally, that these young people could definitely do the job, in many cases far better than I can. And that has helped with our growth, because I can depend on other people, sit back and focus on other things, and know that they're going to be taken care of. Um, we were talking earlier, and I have to inject this, but we were talking about young professionals. Um, you personally were the first doctor who came into our organization. When I learned that I was going to have a doctor in the organization, that's a special thing. I mean, we've had women who've gone to nursing school, men and women who've become physical therapists and occupational therapists. Many of them who have come back and given back and been interviewed, we really never had a physician. So that's been exciting.
It is honestly a privilege for me to be a part of this organization. And it is so interesting, Mr. Kaiserman, that you build this organization and you've made it capable enough to grow even after COVID hit. And this organization is completely remote at the moment. I'm just curious to know, how do you trust the people that you've not personally met and all the interactions are via emails and or over Zoom calls or just video calls? How do you trust these individuals to lead a dream of over 10 years? And how do you find that faith? And how do you recognize that this person is has got something that they're going to carry it forward with the
That's a
organization?
good question. And I think the one answer is that because I identified that skill in the classroom. I mean, as a professor, I we recognize those who had potential, those who had great potential, and after a while, you get good at it. And so, most of the people who have taken leadership roles have been appointed by me, um, because I saw they didn't come in. Many of them didn't come into the organization in that leadership role, but after a couple of months, I saw that they were quite capable of leading a certain area. And that's what we did. Um, you mentioned COVID. That's an interesting, quick story. Um, we had been totally live in terms of our interviews, and people who worked with me were from Philadelphia prior to COVID. When COVID hit, it was in March. Actually, I think they celebrated the first anniversary. Today is what, the 23rd of January? I believe they announced yesterday that in 2020, this yesterday was the anniversary of the first time it came to the United States. So again, we were in early part of the spring semester 2020. I knew when 2020 came and we were in COVID, that there were hundreds of men and women who were going to graduate in the spring and had to finish an internship. So I said, what can I do? And I said, you know what? If we've been successful doing this locally, why can't we do this virtually? Now, you have to understand, I had some real hesitation about going. I was one of the professors that held out about doing online classes. I was not into online classes. So I had this concern that, was this going to work? Okay. So I put out a fast email across the United States using the social media platforms that we had an organization that existed and we would be willing to accommodate anybody who needs an internship to the best we could. And I must have gotten over 700 responses. Well, we couldn't put everybody to work, but we tried to do as many as we could. We did it all online. And from that point forward, despite that we're beyond COVID, we've never turned back. So we got so used to bringing talent from all over the United States that this has worked perfectly for us. And most people I've never met in person, but we've gotten to know each other through email and through social media and Zoom and stuff. And so virtually has been a wonderful experience.
Yeah. What That really is a touching story for me. I'm a recent graduate as well, and I'm somewhat transitioning into a public health career after being a doctor for a while. It is so rare to find the same connection that you find with your teachers um, in your institution, because they believe in you. They know that you're building a new skill, so they're kind, they're compassionate. But once you get into the real world, it's so hard to find a job, and especially as an immigrant, it was personally, it was a very challenging time for me. But it is for people like you, it is for the organizations like the library who put faith in passionate people who want us to grow, who want us to make mistakes, and the trust that you show in this virtual world that we've created. I'm grateful to be a part of this
Thank
organization.
you. I'm
Kaiserman.
grateful for everybody who works. I'm grateful for you, and I'm grateful for everyone else who's worked for us in the past and works for us now.
Thank
Yep,
you so much. And for all the people who are watching, we do have an announcement to make. Mr. Kaiserman, please go ahead.
sure. So after 10 years, I'm stepping down as executive director, and we are putting a leadership team into place. And it was time for me to pass on the baton. And I'm very, very confident that in all aspects of our organization, this will be an ongoing process. I will keep myself available to be a consultant when needed. But I really felt that we had put together a team, especially over the last 6 months, that would drive the organization to a new future. So it's a win-win, win for me, win for them, and I'm very excited about it.
Yeah, it came as a complete surprise for me. Your leadership has been remarkable for everyone at the organization and for all the loyal viewers that we have gained over the years, and for everybody who's connected to the organization. And finally, um, I want to ask this question. What vision do you have for the future of the National Library, and what direction of growth and hope do you see for the organization?
I hope that we've been able to do so many things. I mean, sometimes when I look back, I just can't believe what we've been able to accomplish. Um, I hope that the new leadership will continue to add content because we, as you've mentioned, we have people literally from all over the world visiting the site. We call it a portal. Um, Visiting the portal every day to gain information. I mean, sometimes I get emails from people who say, I live in Portugal or I live in Norway, and I really could relate to that video that I saw on Alzheimer's disease, or I could relate to the on Crohn's disease because I just was diagnosed with Crohn's disease. Um, so that the content should be expanded through our communications group, that more people become aware of what we've put together, and that our publishing division continues to flourish. We've been so fortunate to find great people who can lead our, we have a journal that's coming out quarterly that's been well received with amazing articles. And we're hoping that the rule is supposedly that if you publish a year worth of um, issues, whether it be quarterly or weekly or monthly, you can then apply to the databases to be indexed. And that's my hope, that the journal will be indexed so that when students go into the library, they can index the articles, that they can access the articles that we've written. And with our publishing division, that we continue to publish great books. I mean, we've had some unbelievable topics covered, and it's just really just been a wonderful ride and a wonderful journey for me. And I look forward to it continuing and seeing what new things happen under the new leadership, giving them full reign to go ahead and do your thing and make it happen. And, young perspectives will change the direction of the library in itself. So I'm looking forward to watching what happens.
Wow. Thank you so much, Mr. Kaiserman. Any
Welcome.
final words or thoughts of motivation from a teacher to a student or anybody who's watching, who's passionate about health, public health, medicine in general, or any life advice that you would have for them?
Just find your passion and find opportunities to do it. That's what we tried to provide. I will sort of plug a new project it hasn't been announced yet, but this is a good place to put it. I, with some other retired professors from all different disciplines, are putting together a project where we will be providing short courses on Zoom, free of charge, on a variety of issues. And I'm up first, and I'm going to be doing a short course, again, free of charge. I think we'll be doing it one night a week. Mine is going to be on medical ethics. So we'll be using a textbook, and the other professors will be using textbooks for their courses too, inexpensive textbooks. Almost a continuing education for anybody who really wants to embrace a topic where the guidance is by somebody who has studied this and wants to share their knowledge and their passion for the thing. And I've always had a passion for medical ethics. So I'm the first one up, and more information will be coming momentarily through social media about that project. But we're very excited about it, and hopefully that's going to be a nice next step in my journey in terms of teaching.
Well, thank you so much, Mr.
You're
Kaiserman.
welcome.
On behalf of the organization and all the students that you've taught, thank you so much for your service.
Thank you.
We appreciate professors like you who appreciate our talents and want to give us the opportunity for learning and to grow. Thank you so much once again. Appreciate you
Welcome.
being on this episode.
Thank you. Thanks for the opportunity. Great. Bye-bye.